Cucamonga Valley Medical Group is committed to helping us all better understand the COVID-19 crisis. That's why a series of videos are being produced and distributed so that we can all get a better understanding and the connecting of the dots from Dr. Rahmi Mowjood, the Chief Executive Officer and a shareholder of Cucamonga Valley Medical Group, and Dr. Kyle Smart, the Chief Medical Officer at CVMG and also a shareholder. Dr. Smart, we've heard about flattening the curve, the trajectory curve, all this stuff, and I want to make sure we have time to dig into that, put up the graphs that you have shown me and others. But I want to start off with this. People want to know, is anything working, and what's working the most throughout the world of all that's been done?
Well, thanks, Dave. Thank you. It's great to work with you and Mass Solutions. Yes, when you look at the data, and I guess it would just help to walk through the process I went through to try to explain this. Okay, so we've been working on this video for about a week and a half now. And when we started, it was about March 18th, and the worldwide infected was 217,410 people. And just a short 11 days later, we're at 726,187. So, I mean, this is stressful. But when I started walking through exactly what can we do, how do we know we're winning, I started learning that following the death rate wasn't the only important thing to watch. Watching critically ill was also important. And so everybody started learning about flatten the curve, okay? Flatten the curve. And flatten the curve was a little bit of a dismal message, because what it really means is the total number of deceased and the total number of critically ill doesn't change. It just spreads it out, right? You take that top curve and you squish it down so that our healthcare system can digest the sick people coming at them, and it spreads the same numbers out over more time. And that's a dismal message. But when you combine flatten the curve with the trajectory curve, you start to see, we could see those up to about 2 weeks, Italy and South Korea were tracking with each other. And then South Korea started taking some measures where they not only flattened their curve and spread that out over time, they actually positively impacted and decreased their critically ill and their deceased, their death, their fatality rate. And that was an awesome finding, to see that the things we are doing right now and can do right now can not only spread out the sick and the dying, the morbidity and the mortality, but we can actually impact those and decrease them. And it has to do with what we talked about in the last video. It's decreasing that R naught. If we can decrease the spread of COVID-19, then we can impact things that way. And if you look at the stats, the worldwide death fatality rate was about 4%, and Italy was up around 10%, and South Korea is down around 1.5%. So the numbers show that what they're doing is working.
Dr. Mowjood, you've talked a lot about hope and realistic hope. Jump in on how much the trajectory curve changes that complexion from that standpoint.
Yeah, Dave, in essence, our destiny is in our own hands. And the hope is there, because if we really take to heart all of the recommendations that we've been talking about, then the stats that Dr. Smart referenced become a reality to us. And the morbidity and mortality rate not only drops, but those numbers actually become less. So it's more than just, okay, well, I'm not doing this, I'm staying at home. It's also really reaching out and telling an elderly family member, no, don't go out. It's working to help people understand. There was a recent story I heard of some young kids that were removing police tape from a local park because they wanted to play. They were teenagers. It's that type of messaging. Hey, look, we know this is hard. We know it's frustrating. We know that it's tough to be cooped in the house. But by doing even something simple like this, you're really putting a lot of other people at risk. If we can take control of that, then our destiny is in our own hands. And the level of hope that we can achieve skyrockets, because we can make these numbers a reality. it's really hunkering down. It's really making sure that we're supporting each other. It's really making sure that all of these measures, that we don't buy into the hysteria and the panic. We really take deep breaths and find a way to make this as manageable as possible so that we can start seeing our curve, the United States curve, start to flatten out as well.
Dr. Smart, I want to come back to you on this because we've heard timelines as a target date of Easter, and you need 8 weeks of this, 10 weeks of that. You have some of the stats based on South Korea and so forth, and you had sent me a blog post earlier today. Talk about the length of time and how this might go with the social distancing and so forth.
So what we're trying to do in these videos is exactly that. Come to an answer where we can help people understand how to prepare. So when we combine lessons learned from past pandemics, we combine an understanding of the statistics, we combine the flatten the curve and the value there, so we don't overwhelm our healthcare systems, but we finally combine that with, the trajectory curve, then we can understand, look, we want to achieve, short of a vaccine or an antiviral, we want to achieve herd immunity of 60%, and it's going to take about 8 to 12 weeks to get there.
Do you see it as 8 to 12 weeks and then we're done, or do you see it as 8 to 12 weeks and then maybe a couple months later we have to do it again for 8 to 12 weeks?
That's a great question. So again, the 1918 flu pandemic came in 3 waves. The 2009 flu pandemic came in 2 waves. I think we need to shelter at home and do everything that we're doing for about that 8 to 12 week time. And then we will resume life on a new normal, which we're going to talk about in another video. And then another wave's going to come. And then we're going to have to do this again until we get to that 60% herd immunity, where the virus has been it's not contained. It's better than mitigating. We've suppressed it enough where we've developed that herd immunity with as minimal human cost as possible.
Right.
That's our goal. We're a democracy. And a democracy fights for life and liberty in that order. And thankfully, we're not in the theater of war. And some of these places like Italy, God bless them, have had to make really hard decisions about triaging and life and who to treat and not to treat because of lack of resources. And we don't want to be in that situation. So I think we need to, when people understand it like that, I think they would understand a little bit more about why we're sacrificing for about an 8 to 12 week period, then resuming to a new normal, but expecting another wave of COVID infection to come, because that's what history has taught us. And that's what this virus is looking like.
And I think that it's important for us to look at that reality in a hopeful perspective, because 8 to 12 weeks, we come up with a new normal. In this time, we have to start to really work to be prepared for when it might come back. And hopefully, at that point in time, we are better prepared where we've got more testing. Hopefully at that time, there are antiviral treatments that are now available. Hopefully at that time, like in 2009, there's a vaccine that has started to have some utility where we can now start to protect more and more people, and the herd immunity starts to build. So while we may not necessarily see the end of COVID-19, what we are seeing is the beginning of our humanity's response to taking care of each other. And that human factor, which we talked about in the previous video, how that really takes center stage.
Dave, when we look at the flatten, if flatten the curve was all we had, then that's what we would do. And we would not be sheltering at home. We would rush in like some early policy said, let's just, everybody get sick and get it over with. And when they modeled that out, the critical ill and death rate was catastrophic. But we can do better than that. Like Rahmi said, destiny is in our hands. And when we look at what South Korea did to not only flatten their curve, but also lower their critically ill and fatality rate, that gave me hope. And I think that's a positive message people need to cling to, that the efforts we are doing, the sacrifices we are making are gonna buy us time to do better testing, better tracing, better quarantine, and come up with some treatments which may even shorten this overall pandemic we're dealing with.
You were referencing those stats on another video. If you could get them again, the South Korea stats of the critical rate and the death rate are down to 1.6% or something?
Absolutely. So the current total infected in South Korea is about 9,500. Deceased is 152, and that's a fatality rate of 1.6. And their critically ill is measuring under 1% right now, almost zero.
What do you say to someone that says, but South Korea is like one small state of Pennsylvania in the sheer size, or something like that, you know? And I'm not a population expert. I'm just saying, I've heard people say, yes, South Korea is nothing like us. So what do you say to someone that says that?
I think that's a great question, and I will answer that. So it's kind of stressful to see the United States has become the highest place, where we lead the world in most infections. We're up to 140,000 infected. And so that's a result of our high population. There's about 320 to 330 million of us in the United States. So of course we're going to have more infected people. But if you look at our fatality rate and you look at our critically ill, we're hovering down towards South Korea. We're well under the worldwide average, which is currently 4.7 and 3.4. So 4.7 is the current worldwide fatality rate, and 3.4 is the current worldwide critically ill rate. The United States is at 1.8 for each of those. That's not because we're better than other countries. That's because we've learned lessons from countries like South Korea, and we're sheltering at home. We're giving up some of our freedoms. We're isolating. We're social distancing. We're washing our hands. We're cleaning common areas. I mean, I'm proud of Governor Newsom that he had the courage to take a stand when he did, because it's positively impacting California right now. And my heart goes out to New York. My heart goes out to Louisiana and Washington State, where this kind of all started, because we're going to see those things keep happening. And we've got to keep fighting the good fight of making these sacrifices and doing these social distancing and stuff. I know it's hard. We're watching our economy. We're watching our kids' school, universities, watching people's get isolated, depression, anxiety are going up. And to me, when I say new normal, when we get done with this current wave and this current 8 to 12 weeks of isolation, the new normal will address those things. It'll address education. It'll address the economy. It'll address the new way of life. And that's part of the human spirit that gives me hope that we are going to get through this together. And again, there's a leadership opportunity for governmental and healthcare, high healthcare levels like the World Health Organization and the CDC. But in the absence of their leadership, we will lead, and communities will come together and we will get through it at that level.
Rahmi, yeah, I want to jump to Dr. Mowjood to close, because you have pounded this message of hope and humanity and so forth on your videos throughout this. And I found it compelling, and I love what Dr. Smart just said. Do you want to just close with anything to add to that and talk about the human aspect and finish this as our second video interviews?
Yeah, I think what Kyle said really was succinct and sound. There's going to be a new normal. There's no doubt about it. Whether you're a business owner, whether you're a student, whether you're retired, there's a new normal, and it'll be something that we have to experience socially. It'll be something we'll experience financially at some level, if you're running a business or if you are working for a business, all of these things. I think the message that I'd like to be able to tell everyone is, don't stop. Don't stop what you're doing. Don't think that, okay, I've done this for 2 weeks, I can go back to work. Okay, I'm getting tired of doing this. I think we can have people over. You know, my kids are going crazy. I think we can have a play date. This is vital. Don't stop that, because these are the things that are really keeping our fatality rate down. All right. We can fix an economy that has shuttered or slowed down, right? We can build our businesses back up. We can get caught up with school, right? Our kids can get caught up with all of the things, whether it's a dental appointment or whether it's vaccines in the 4, 6, 8, 10-year range. We can do all of that. What we cannot do is bring people back that we've lost. And I think it's super important that we are not in the business of saying, okay, we're willing to say that this group of people might be sacrificial. That's not what we're saying. Everyone at the local level, we need to work to protect. And don't start to think that time has passed long enough where I can start to loosen. That is not the message we want. The hope comes from us hunkering down and really working hard to protect each other so that as time goes on, we try to keep as many people here with us as possible.
Dr. Rahmi Mowjood, thank you, and Dr. Cal Smart, thank you as well. We want to thank Cucamonga Valley Medical Group for you all putting these resources, videos together for anyone, for patients, families, the community, other physicians. It's really helpful, and I'm happy that you guys have allowed me to be a part of it. And onward to our next video.
Thanks, Dave.
Thank you.